Good afternoon. This webinar series was developed by the Colorado Older Adult Falls Prevention Coalition, specifically the community-based Older Adult Fall Prevention Team. Members of the team represent hospitals, public health, and other community organizations. The team's mission is to reduce the risk of falls through education, raising awareness, advocacy, and improving access to resources. The role of the team is to provide leadership and guidance for local falls prevention efforts. Today, you may type in questions while the webinar is going on, and then at the end of the webinar, we'll have a question and answer time, and we will try to go ahead and unmute all attendees so that we can talk back and forth. However, if technically that's not working, we'll put all the attendees back on mute and answer those questions that you have typed in. Today's moderator is Melissa Pruitt. She's a community fall prevention specialist, and currently she's a wellness services coordinator for the Boulder County Area on Aging. She is through ACE, the American Council on Exercise. She's group instructor certified, and through the Senior Fitness Association, she's personal trainer certified. The first presenter will be Pam Allen, who is also a community fall prevention specialist, and currently the Education and Communications Manager at the Consortium for Older Adult Wellness in Lakewood. The last presenter will be Sally Thorson, who's the Injury Prevention Coordinator at the Prevention Services Division with the Colorado Department of Public Health and Environment. So today we're going to be talking about building block number 2, which is exercises that can improve mobility, strength, and balance. And many people assume that falls are the inevitable consequence of getting older. And yes, according to the Centers for Disease Control, 1/3 of people over 65 fall each year. But we need to remember that it isn't simply the numbers in your age that contribute to falls. If you really take a look at what happens, there are many factors. And what we do know is that staying physically active can reduce one's risk of falling at any age. So how does exercise reduce the risk of falling? What we know is that many adults begin to restrict their activity as they age. And so even in the absence of disease, balance can be greatly affected by inactivity. We see reduced muscle mass resulting in loss of strength, the loss of flexibility, and a loss of sense of balance. There's been a lot of research going on about falls and fall prevention, and what does the research tell us currently? One look at trials and a systematic review of the data now provide clear evidence that falls in older people can be prevented with appropriately designed intervention programs. And although there are many risk factors for falling, here's the big thing. The effects of exercise as a single intervention seems to be the best approach to fall prevention at a population level. This is a powerful statement. Think about it. Here's an approach that has been shown to reduce the risk of falls. It doesn't require prescription medication, and relatively speaking, it costs very little to implement. So what does an exercise program need to include to produce these kinds of results? First, the exercise for fall prevention should provide a moderate or high challenge to balance. Exercise needs to be undertaken for at least 2 hours per week, and these programs need to be performed on an ongoing basis. So our first challenge is we need to get people to exercise. But once we get them started in a program, it is very important that they continue. And you can see that the programs need to be challenging, and again, they need to be performed at least 2 hours per week. how can we take this information and then implement a program at the community level? Well, the first thing to do is investigate evidence-based programs. And the reason for emphasizing evidence-based programs is these are programs that have already been proven to work. And that's why we're going to focus on these today during our discussion. But other than that, in addition to just investigating evidence-based programs, you have to encourage people. People have to, first of all, start an exercise program. You have to just take people where they are and then move them forward from that position. You have to stick with the program, and again, you need to perform moderate to high challenge exercises. So the evidence-based programs that are going to be part of our discussion today are Stepping On, Matter of Balance, Fall Proof, In Balance, Tai Chi that is moving for better balance, and then a second Tai Chi for health program, and the Otago program.
First, we'll talk about the Stepping On program. The Stepping On program was presented in the previous webinar 2 weeks ago, focusing on education as the building block for a community falls prevention program. So today we will just highlight and talk about the exercise component of the program. So during the first week, Stepping On is a 7-week program with a follow-up booster session 3 months later. During the first session, 35 minutes are spent to introduce the exercises. A physical therapist is in the class that day to do this, to describe the exercises to the participants. Then in the remaining 7 sessions, the exercises are practiced as a group for anywhere from 10 to 15 minutes. Your physical therapist comes back and leads the exercises in sessions 2 and 6. Adjustable leg weights are introduced to the participants, and each participant receives an exercise handbook and an exercise log to record their practice at home. And then each week when they come back, the exercise log, which has been their homework, is used as a discussion point for a while to talk about how their exercises went and any challenges or problems they may have encountered in trying to do those alone at home. So in Stepping On, there are 4 balance exercises and 4 strength exercises. Start the video now. Here we're viewing some of the exercises being done in the Stepping On community class. You can see in this particular class we set up and sit around a table. And so in this we had enough room. We pushed our chairs up. And right now the participants are doing one of the balance exercises, which is tandem or heel-toe walking. And in this, we went around the outside of the table because we wanted to provide a place for people to rest their hand or to hold on if they needed that help. The way this exercise, we all started at the same. And then if people wanted to challenge themselves a little more in this, they were able to walk around and not hold on to the chair. If this was hard for them to do in the beginning, we would have them, rather than the absolute heel-toe walking called tandem, they would walk with the front foot just a little bit further ahead and a little to the side. So there are ways for them to make this harder or less difficult. Now this, we realize the video is jumpy, so bear with us. At this point, we are introducing the ankle weight. So in this program, an ankle weight is provided for each participant. It's adjustable so that they can have anywhere from ½ a pound to 5 pounds. And we described to them the only way we use the ankle weights are in 2 of the strength exercises, which are the side leg lift to the side, and the other one they use when they're seated for the seated, just ankle lift from a seated position. So there's the 8. I think that is probably the video. Okay, come back to my screen. So the 4 balance exercises are sit to stand, sideways walking, the tandem heel-toe standing, and the tandem heel-toe walking. So each of those has a way to make it less challenging if it's hard the way to begin, or they're also, we taught and they're encouraged each week to increase either the number of repetitions or changing their whether they hold on or they let go. So they're using their hands for the support. And then for strength exercises were the side hip strengthening, which we were doing in the video, the knee strengthening, which is seated foot raises, heel raises, and toe raises while standing. Okay. So stepping on, the requirement to be able to do a stepping on program. Stepping on requires 2 trained facilitators in each class. So the leader training requirements, the prerequisite in this program is you need to be a healthcare professional, a fitness instructor, or an aging network professional with experience leading groups of older adults. So in this one, if you want to go to a leader training, there is an application that you will get from the people providing the training to fill that out, and they will help you determine if you're a candidate. It's a 3-day training, and right now in Colorado, Health One, they are implementing this program in their system, so they conduct trainings there for Health One employees. And then the Consortium for Older Adult Wellness will also be holding trainings, and those will be open to anybody in Colorado. The next program we'll talk about is Matter of Balance. This program was also talked about in the last webinar, in the education webinar. So this time we're just going to talk about the exercise portion of it. Matter of Balance is an 8-week program, and the exercises are introduced in session 3. And the coaches, leaders in this, they lead all the exercises, and it's 45 minutes are spent the first time. So they can go through all of the exercises so that all the participants will understand how to do them. Then in each subsequent session, the exercises are practiced for about 25 minutes. They don't get through all the exercises in that time, but they can do different ones different weeks. And in this as well, participants receive the exercise handbook to take home so that they can practice at home. So in the Matter of Balance, it has a lot more exercises than the Stepping On did. They do warm up and cool down, and these are done seated. So they're very gentle, stretchy type exercises. Then there are 19 strength and balance exercises. And the strength exercises include upper body, arms and hands. So if you go ahead and show the Matter of Balance video. That's the imbalance video. This we need the MOB. Bear with us. Here we go. So this is a Matter of Balance class that I went and did some video of. So you see they'll do a combination of seated and standing. So these seated videos, you can see they're doing arm stretches across the body. They're doing the rowing. So these are arm strengthening exercises. They're encouraged to begin adding exercise to their daily routine slowly and to work up to 30 minutes of activity most days of the week. They're told that 10 minutes of activity at a time is fine. They're told to include the balance, stretching, and strengthening and aerobic exercises to get the right mixture of physical activity. So here's a standing one. They're doing marching in place. You can see this woman. She has a cane there, and each person, when they do stand, they have them stand behind a chair or next to a chair so they can use that if they need to have a hand to help them balance or just there especially as a safety. This one is called the box step. So this is a very good balance one where they step to the side, then they step back, and then they step forward again. This one is leg lift to the rear. Probably not the correct term. Leg slide because the toe doesn't come off the floor. This is one, I can't tell me the name of this. Leg slide to the side. So this is straight, this is a good balance one. And you even see the instructors there because they're reading, describing how to do it, and they even keep their hand on the chair for safety. Here we're doing wrist raises. So that's going to be a hand stretching, and this also flexibility. You'll notice in the matter of balance, these look to us very simple. But what matter of balance, what it really speaks to is people who haven't done anything physical, are not doing exercise at all. And so what matter of balance, a main goal is to get people to decide that they want to begin exercising regularly. So that's what these will do for them. Here they did the sit to stand. Now they're doing the hip rotation. So a goal is for these people to continue these exercises, do them for 30 minutes a day, get used to the fact that exercise makes them feel different, and then hopefully at the conclusion of this, they will decide to go ahead and enroll in another exercise program that will challenge their balance much more. Thank you. So matter of balance, talk about training to be able to do that program. It also takes 2 trained co-leaders to do this program. It's an 8-hour training that typically is done in 1 day, and then annually a 2.5-hour training update that can be a webinar, or it could even be email and phone support from your master trainer. So training in Colorado, COA, the Consortium for Older Adult Wellness, we hold trainings 3 times a year, and then you could do the program under our license. And then there's a lot of other organizations that have master trainers who are implementing. And to find out, it's through the State Unit on Aging, because that is where they can be able to tell you statewide what local area agencies on aging are doing this program.
Okay, so the next program on our list is Fall Proof. Fall Proof is a multi-sensory approach to balance training, and its exercises look far different from anything you've seen so far. The exercises are presented in a progressive fashion, and they're designed to address the systems that contribute to balance in our body. So that would be the visual system, somatosensory, and the vestibular system. And the leader training requirements for Fall Proof, so 1 year, you're given 1 year to complete an online course, and it takes approximately 100 hours. In addition to that, there's a 3-day competency and evaluation workshop, which is generally done at University of California in Fullerton. Prerequisites for this program, you can see, are BS in kinesiology, being in physical therapy or related fields. For example, an occupational therapist, maybe exercise science, or nursing field. And a minimum of 2 years of working with older adults in exercise or rehabilitation settings. If you're interested in this training, you would contact the Center for Successful Aging at California State University at Fullerton, and you can see the phone number there on your screen. We're going to spend a little more time talking about imbalance. Imbalance is based on the principles of Fall Proof. Again, it's a multisensory progressive approach to fall prevention. And the idea for imbalance came about as a way of taking the information that's in Fall Proof and making the training more accessible and more affordable. And our end goal was to make a program that could be more widely available in our state. So to get the best results from imbalance, the class is taught for 1 hour twice a week. Generally, the sessions run for 8 weeks. You'll see them anywhere from 6 to even 10 or 12. But the results that we have are based on 8 weeks of class twice a week. And again, the exercises are designed to target the visual system, somatosensory system, and the vestibular system. So know that balance can be improved for many people by retraining muscles to respond and to react to changes in position and support. And these are important components of imbalance and fall proof. We want to put people into new and challenging situations. So the instructor training emphasizes the importance of the order in which these challenges are introduced, and it is the utmost importance to keep our participants safe while doing it. And we spend a lot of time in the trainings discussing these elements. So how does imbalance work? The exercises are done seated, standing, and moving, and we can sort of accommodate people at a variety of levels in imbalance. So everybody doesn't have to be able to do all the exercises standing when they start, but there are some tests that we do in the beginning to find out if they're appropriate for this program. In imbalance, we're creating unstable surfaces for the participants, both seated, standing, and while moving. So we do this by having people sit on discs. We have them sit on footballs with and without holders as they get more confident. We have them stand on first on the stable surface, the floor, but then we quickly introduce more, less stable surfaces like foam pads, dips, rocker boards, and foam rollers, to name a few. And then again, once people are moving, we have them moving around, stepping on and off of these same unstable surfaces. And we're going to show the DVD of an imbalance class now. So this will give you an idea of some of the types of equipment you'll see in an imbalance program. You'll see the participants sitting on balls. Some have holders. Some have a chair beside them. The instructor stays close by for the less steady participants. And we have a helper in this class, and that's ideal if you can have two people to help you with the class. And they're practicing getting up and down off of an unsteady surface, which requires a lot of skill. This portion shows practice of gait, and we do work on gait in imbalance programs. So agility is something people lose as they get older, and this makes them more vulnerable for falls when they have to turn in tight places. So you can see here they're practicing walking around the cones. They're having to make changes in direction, and the instructor staying close by. Here they're working on taking a step forward and trying to put their foot, that heel-to-toe position that we discussed in a previous DVD. This will help with balance and also having to cross over and walk sideways. In many situations, people lose their balance when they are forced to move sideways. So this helps improve their ability to do that. And this is going to be some of the most advanced activities that you'll see in an imbalance program. Here the participants are using a half foam roller, and they're having to keep themselves balanced while they hold the position on the standing on the roller and then shifting their weight. Here they're using strategies that we call strategies to maintain your balance. So you have to be able to use your ankles, you have to be able to use your hips, you have to be able to step forward to prevent falls, and that's what they're practicing here on these foam rollers. Again, you'll see the attention to safety with the participants next to a bar that they can hold on to, and the instructor staying very close to make sure they stay safe. And they even practice, you'll see them practicing stepping off backwards. So if you are interested in becoming an imbalance instructor, the requirements are there's a 4-day training, which is held through COA, and Pam is your contact there, and you can see her phone number. These are generally held 2 times per year through COA. Now we're going to talk about a couple of Tai Chi programs.
And I want to start out by why is Tai Chi good for fall prevention? For fall prevention, for talking about to challenge your balance, when you're doing these Tai Chi programs, you're on your feet and you are standing in place, or you're taking subtle steps, or you're taking bigger steps sideways, forward or backwards. So you are changing your base of support. You're changing your base of support, widening it, making it smaller, and you're moving your center of gravity. So let's show the DVD. You could. Hopefully you can see this one. I just heard by some people in the next room that the imbalance one wasn't showing. So in this, it's just showing a leader training of a Tai Chi for Health program where you're standing, you start with your feet together, then you very gently and deliberately take that sideways step. So in the Tai Chi, anytime you get ready to take a step, you are very centered. You feel by your core where your balance is. So as you start to shift your weight, you make sure that your weight and you're absolutely stable on the one foot before you lift the other foot and move it. So that is a very core thing to use for your fall prevention and for balance. This is a wave hands in the clouds, which is a very common Tai Chi move that's used in a lot of different programs. But it's sidestepping. You step to the side with your feet further apart, and then you bring in one of the feet a little bit closer. So in each one of these, it's very, this film is jerky, but you're doing very subtle weight shifts. Thank you. The first program we'll talk about in Colorado, it's called the Tai Chi Moving for Better Balance. This is a program that's 24 Tai Chi forms, and it emphasizes the weight shifting, postural alignment, and the coordinated movement. So your program goals are to improve balance, strength, and physical performance in adults. And it is a very good strength exercise because it is a weight bearing. You're on your feet doing this, so it's very good in building up your lower body strength. You do warm up, you do the Tai Chi form, and then you do cool down. So this one, ideally, is a 1-hour class held 3 times per week for 24 to 26 weeks. That's what's recommended. Practice at home is encouraged. The target population for this is 65 and older, community dwelling adults, and the recommended class size is 15. So the instructor training requirements for this, it is a 2-day training, and this program has the prerequisite should be familiar with the fundamental principles of Tai Chi and the major postures of movement, be able to follow the training protocol, and have experience teaching physical activity to older adults. And be an experienced Tai Chi instructor who follows the classical Yang style. So training in Colorado for this program, the YMCA in Denver has adopted this program, and so they provide training for their YMCA employees. And this is one of the programs that the Colorado Department of Public Health and Environment has in a grant through the CDC. And so they are doing training and implementation. You can see there you would contact Sally Thorson and her phone number. So we'll also talk about another Tai Chi program that is in Colorado. It's Tai Chi for Health, and this is out of Australia, Dr. Paul Lamb's Tai Chi for Health. And the two that we'll talk about is the Tai Chi for osteoporosis, and then the Tai Chi for arthritis and pulse prevention. The Tai Chi for osteoporosis has 10 moves, 10 Tai Chi forms, and the arthritis is 12. And they focus on the shifting, postural alignment, coordination, and movement. The program goals are to improve the muscular strength, flexibility, balance, and to build lower body strength. It also has the warm-up, then the Tai Chi form, and the cool down. And this is 1-hour classes held at least twice per week for 24 weeks. And practice at home is encouraged. I want to point out that both of these Tai Chi programs I've talked about, they can be done for fewer than the 24 to 26 weeks. But that's what the studies were done on. The Tai Chi Moving for Better Balance is being implemented as a 12-week program. And these Tai Chi for Health classes are done anywhere from 8 to 12 weeks. What we find often is when people begin a Tai Chi program, they learn the form, and as long as they continue to practice, they are improving their form. So they might conclude a 12-week program and then sign up again and just continue on, and that's what's nice about these Tai Chi programs. Tai Chi for Health program, the instructor training requirements are similar. It's a 2-day training, and the prerequisite for these particular programs are you study with a DVD and a handbook, you study at home, and you learn the form prior to attending the training. And trainings in Colorado, you can find them through COA at least 3 times a year. I also would like to say that Tai Chi programs in general are very good for fall prevention, with the caveat that they have been adapted for older adults, especially adapted for older adults, so that no injuries can happen. Next is Otago.
Okay, this is Sally Thorson, and I'm going to have Pam just advance my slides because I just have a few of them to talk about Otago. And it's a one-on-one exercise program delivered by physical therapists in the home. So it's not the group exercise program. And the Otago program is out of New Zealand. The model is out of New Zealand. It's been adapted to as much as we can to the American system. And it goes over a year with home visits and also phone calls to reinforce what's going on. And their in-home exercises is the main part of it, and then people are also encouraged to do some walking. The evidence is really strong on a reduction of falls. And the next slide, you can see that the ideal candidates for Otago are people that are older.
Sally, let me stop you just for a moment.
Okay.
I'm not able to advance my slide.
Okay.
There we go. Okay, go ahead.
Okay. The ideal candidates for Otago, as you can see, are ones that are probably not going to be able to come to group classes. They're generally 80 and older, dwelling in the community, so it's not a program that's been tested in nursing homes or assisted living facilities. People generally have fallen in the last year, have muscle weakness and poor balance, but they are able to get around in their own home with or without a walker, cane, or type of walking aid. And also because this is a program that works with Medicare for billing, they meet those definitions of homebound and home care, and I'll explain those a little bit later. So the next slide, the way people get into Otago are referrals to a physical therapist from a primary care provider, and using this kind of wording helps the PT realize that they need to consider Otago because the doctor has advised that they have balance and gait weaknesses. The other way a program can go, and both of these will probably be happening in Colorado, is a physical therapist determines that they're working with somebody and they know about Otago, they think this person would be perfect for Otago, so they go to the physician and negotiate that plan of care and institute Otago. So the next slide is a little bit more about the billing, and it is not easy to do, much easier to do in New Zealand, but Otago may be covered by Medicare, and of course the other exercise programs are not, if the patient is diagnosed with a gait or balance problem. And there are different forms of Medicare. Medicare only covers home-based physical therapy, so they have to have someone with that level of training. And under Medicare A, Otago can be started through a home health agency when the patient meets homebound criteria. So they're not able to go to classes, they're really not leaving their home for very long. And under Medicare Part B, Medicare may be able to pay for home care by a physical therapist. So physical therapist, the person might be able to get out in the community, but it still meets criteria so they can bill under Medicare. Usually there's a copay. The difficulty is also that someone might be homebound and then be not covered by the homebound characteristic, but could transfer to Part B. So you can see it gets confusing and something we're trying to work out in the state. And Medicare C or Advantage programs also have the ability to bill for Otago, and we're currently working with Kaiser as a pilot program to see how that would work. So the next slide is really, again, it's very similar to the kinds of exercise you saw before. It can be very simple balance exercises that are progressed as the PT works with the individual person to get them to do very simple balance exercises, but very effective. And the next slide is, you saw this in the videos on strengthening, and they use ankle weights, so it's amazing that you can get 80, 85-year-old people using ankle weights and really progressing in their strengthening and their balance. So the next slide is really the why use an Otago program. Well, it really works, and the physical therapists that have used this program in other parts of the U.S. say you can really engage older adults by saying, if you stick with me for a year, I'll be here every month or every couple weeks, and we really know it works, and I know you'll see some great results. So it's a commitment from the older adults, but knowing that there's been testing in these randomized controlled trials, which is the highest level of evidence for most programs that look at evidence-based, and the improvements were in reducing falls, fall injuries, and fall injury risk. In addition to the improvements, the important thing is strength and balance is also improved. And Otago also, because of the relationship the PTs develop with the older adults, it has really good adherence with people completing the program. Considering they're 80 years and up and have a lot of other health issues going on, people are completing it and following through because they get committed and excited about it. The Otago is one that we're using, we want to promote through the state. One reason is because it is one that's been proven. Other kind of home-based programs don't have the kinds of progressions and exercises that work, that are proven to work with Otago. And for PTs, the training is really pretty simple. 2-hour training to sort of learn the steps in the program. PTs know about these exercises and how to progress them, but they learn about the requirements of how to put the program together. And it is for physical therapists. It hasn't been approved or being moved into other types of professionals at this point. And if anyone is interested in learning more about Otago and when we might be holding webinars or online trainings, you can give me a call. So that's the Otago part. So back to Pam.
Thank you, Sally. Actually, it's back to Melissa. So you've heard about all these different programs, and what's your next step? What should you do to implement these programs if you currently don't have anything that you're doing, or maybe you're doing one or two and want to figure out what you should do next? So the first question to ask yourself is, who will your program serve? Are most of the people able to get transportation to an exercise site, or is your target audience more isolated? And who will be your exercise leaders, and what kind of training do they need? And certainly a very important consideration for all of us is, what is your budget? How much money do you have to bring an exercise program into your community? So try to be creative in your approach. Think about the resources that are currently available. Is somebody already offering a class at a YMCA or a local rec center or a hospital? Or is there a physical therapist doing something? You don't need to recreate what's already being offered, but maybe there's a way to utilize other organizations. Maybe your organization would be best serving the less active population of seniors, and Matter of Balance might be a good one for you to do, where In Balance might work better at the rec center because they have a lot of equipment available. Or maybe you can offer Tai Chi classes for seniors because nobody else in your area has been doing that yet, and you won't be duplicating efforts. You can also think about some organizations have really thought about their programming, and so they'll offer Matter of Balance for 8 weeks, and then the next 8-week session they'll bring in Tai Chi or In Balance to try to keep people going in the exercise once they've started. The point is to be creative, and you want to keep people exercising once they get started, and try to keep in mind those recommendations, those basic recommendations, that exercise for fall prevention should provide a moderate or high challenge to balance. It should be undertaken for at least 2 hours per week and done on a regular basis.
Okay, so that concludes the information we've presented. We're watching to see if people have typed in questions and comments, and we have a few that I will address. We wanted to point out the remaining webinars. These are the dates and the particular webinar we'll be talking about, and that all the webinars, once they've been presented, are available on the Older Adult Falls Coalition website, and the address is listed on your screen at the bottom. So we had a comment after I had presented on the Tai Chi, and this, I was glad to get this comment. I don't know who sent it in, but thank you very much. The Tai Chi Moving for Better Balance. It's 8 moves you learn, not 24. In the research I did, I found conflicting. I found 8 and 24, and so I'm glad that someone out there has confirmed for me that it's 8 moves. Thank you.